Some people consider their lives to have been a great success. Other people consider their lives to have been a great failure. In truth, most people's lives are a mixture of successes and failures, triumphs and tragedies. And that's certainly true of my own life. The greatest tragedy of my life occurred almost 10 years ago when my wife, Vivian, suffered a massive stroke at the age of 55. On Friday, 20th May 2011, at 8:30 p.m, I discovered her slumped in the bath, semi-conscious, unable to speak or move. I carried out a quick examination and concluded that she'd suffered a massive stroke. I called an ambulance and she was rushed to hospital where the diagnosis of a massive stroke was confirmed. 5 days later, doctors investigating the stroke carried out an echocardiogram, and that means an ultrasound scan of the heart, and they found that the cause of the stroke was a rare heart tumour called an atrial myxoma. And this is like a giant wart inside one of the atrium, the left atrium, which is one of the chambers of the heart. Now, what had happened was that a bit of tumour had broken off the atrial myxoma, travelled through the bloodstream and blocked a major artery supplying the left side of Vivian's brain, and it caused a massive stroke. Now, if that wasn't bad enough, a few weeks later it was also discovered that she had suffered a central retinal artery occlusion in the left eye, which was also caused by what's known as an embolus from the atrial myxoma. An embolus just means a particle that travels through the bloodstream from somewhere and then blocks a blood vessel. Later still, it was found that she also had visual loss in the right eye caused by brain damage due to the stroke. Now, the myxoma was removed by open heart surgery on 13th June 2011, but Vivian was left with permanent, severe disabilities. However, there's a lot more to this case. For almost 2 years, Vivian had been investigated by the NHS for various strange symptoms, which included these rather odd blotchy marks on her hands and feet. Now, this is a photograph I took. I don't know if you can see it that clearly. I'll just take my finger away from it and get it a bit closer to the webcam. But you can see that Vivian had these sort of blotchy marks in her hands. So she had these episodes of blotchy rashes on her hands and her feet. She also had episodes of muscle pain, a dizzy spell, a swollen toe, and other strange events. The GPs made a diagnosis of vasculitis, which means an inflammation of the blood vessels. And this is usually caused by some kind of autoimmune disease. And she was treated with high-dose oral corticosteroids. Eventually, she was referred to a consultant dermatologist who referred her on to a consultant rheumatologist who carried out a few blood tests and a chest x-ray and put her on azathioprine rather than steroids. Now, azathioprine is a drug which suppresses the immune system, and it's very similar to chemotherapy agents that are used to treat cancer. On 8th December 2010, the rheumatologist told Vivian that she could not have vasculitis as there were no signs of inflammation in her blood tests. Vivian then said, well, if I don't have vasculitis, what is wrong with me? And he said, well, I don't know. Despite his doubts about the diagnosis, the rheumatologist told Vivian to continue with the azathioprine for a few months and then phase it out. And he agreed to see her in 6 months. Unfortunately, 5 months later, Vivian had her stroke. Now, this video is in 3 installments. Part 1, which you're watching now, is a brief summary of the case. Part 2, to follow soon, is a more detailed examination of all the medical appointments Vivian had in the 2 years leading up to her stroke, including a detailed analysis of all the mistakes that were made. By the way, there were a total of 11 mistakes that were made in the 2 years leading up to her stroke, with the most serious being the failure to order an echocardiogram. And part 3 will deal with what happened with the resulting legal case and the lessons that I believe should be learned from this tragic incident to make sure it never happens to anyone else. In other words, this set of tragic events never happens to anyone else. I don't believe anyone should ever have a stroke caused by an atrial myxoma, as these things can be diagnosed and treated well before it is too late. Now, at this point, I want to make something clear. I am not anti-doctor, anti-nurse or anti-NHS. I am a former NHS hospital doctor. I was a registrar and then a clinical assistant in ophthalmology. My father was a GP. My mother was a consultant ophthalmologist. My uncle was a GP. My sister was a GP. My brother-in-law was a consultant hematologist, and my brother's first wife is a consultant psychiatrist. I have many friends who are doctors, and my first wife was a nurse. All the same, by the way, my first wife still is a nurse. Don't want to get all my facts wrong. All the same, I believe Vivian's stroke and central retinal artery occlusion could have been prevented if the NHS had carried out a more thorough investigation in the 2 years leading up to the stroke. In particular, I would criticise the consultant rheumatologist involved for failing to order an echocardiogram, as it is widely known that atrial myxomas can cause skin rashes which look like vasculitis. This is known as pseudovasculitis. That means it looks like vasculitis, but it isn't really. And pseudovasculitis is caused by small particles of myxoma travelling from the heart to the peripheries through the bloodstream, a process which is known as embolization. Now, the fact that the rheumatology department at that hospital now carries out an echocardiogram on every case of vasculitis or suspected vasculitis is proof, as far as I am concerned, that a terrible mistake was made. But to this day, neither the hospital or the consultant concerned has ever offered what I would consider to be a proper apology. So in these 3 episodes, I will be laying out my case that Vivian's stroke could have been prevented and indeed should have been prevented. Now, at this point, you're probably saying, well, Colin, why didn't you write a book about all this? Well, actually, I did. I wrote this book, A Life by Misadventure, which was published more than 3 years ago, October 2017. And it's available from Amazon, including a Kindle copy, which costs less than £3. So this book describes how I met Vivian just before Christmas 1998, and then our happy life together, our marriage in Cyprus, which was in the 30th July 2022. Keep getting this date wrong. Our marriage was in Cyprus on the 30th of July 2002. It was 8 years before the stroke. So as you can see she looks quite healthy and happy in this photo. It was taken on 30th July 2002, 8 years before the stroke. She doesn't look like that now, unfortunately. The book describes all the errors that were made in the 2 years leading up to her stroke. It also describes my own experience having a massive heart attack in the summer of 2015 and how I spent 4 months in hospital and how I was actually unconscious in a coma on a ventilator with a tracheostomy for weeks, and my amazing recovery after 2 cardiac operations. I was literally on the point of death on 3 occasions. But to finish part 1, how has the stroke affected Vivian? Well, she has lost all vision in her left eye and she only has partial sight in her right eye. If you do this little experiment now, if you cover your left eye with your left hand, take your right eye and cover about 1/3 of your visual field, out the outer visual field on the right side, that gives you an idea of what Vivian sees. And just imagine having to live every day with that amount of visual restriction. Vivian can only say a few words and phrases like bog roll and toilet and love you, which actually she says quite a lot to me, which is quite nice. She cannot drive a car, ride a bike or swim. She has limited mobility. She cannot make a phone call or use a computer or an iPad or an iPhone. She cannot read or write. She cannot count. She doesn't even know what day it is. She forgets things. Tell her a fact and 5 minutes later she's forgotten what you've said. She needs help with most daily activities, including dressing, undressing and bathing. She cannot brush her teeth. Sometimes I have to wipe her bottom. Her right hand is completely useless. I'll just show you this photo here. So this is a photo of her right hand, which I just took last week actually, so it's quite a current photo. And you can see that her fingers are kind of twisted in all directions because of the spasticity and dystonia affecting her right hand. So that right hand is totally useless. And her left hand suffers from dyspraxia. In other words, she has a difficulty in making fine movements, so she can't really dial a number on a telephone. That's the reason she can't use a computer. And sometimes I have to wipe her bottom. She can't brush her own teeth. I have to do that for her. She cannot be left on her own for too long. I have to do all the food shopping, cleaning, cooking and housework. We used to have a Crossroads carer 5 hours a week and a cleaner 6 hours a week, but all that has been stopped for most of the past year due to COVID. All the States provides for us is a carer for 15 minutes each morning who helps Vivian get showered and dressed. And by the way, until fairly recently we had to pay about £320 a month for this very limited amount of care. Another odd effect of the stroke is that she cannot eat most foods. She refuses to eat any vegetables and most fruits. She won't eat rice, noodles, chips and most forms of potato except hash browns and potato waffles. So cooking for her is difficult. I have to chop all her food up for her, and then she eats her food using a special plate fitted with a plate guard and a large spoon, which you can see here. Some of our friends have remained in touch and have been very kind and very supportive, but about half of Vivian's friends have abandoned her. What seems to happen is that they visit, They see what Vivian is like, realise she can't really speak much, and then they never contact us again. Every year, the number of Christmas cards gets smaller. The stroke has also affected me. I only get out the house for essential shopping and exercise. I'm in most of the time. Effectively, we have been in our own personal lockdown for 10 years. Being a carer is a kind of Groundhog Day. Every day is exactly the same, and sometimes even I can forget what day it is. The stroke also set in course a chain of events which led to me having to close down my hypnotherapy and training business in 2016. I was offered the chance to teach hypnotherapy and thought field therapy courses in London some years back, but I had to turn them down as I couldn't leave Vivian on her own and couldn't find anyone who was willing to look after her while I was away, even if I paid them. The last time I had a break from caring was almost 3 years ago, when I had a 3-day break in London. It was expensive because I had to pay someone to stay in the house for 3 days while I was away. I also had to increase the carers' visits to 3 times a day. We have been on some holidays since the stroke, but these are difficult and expensive, as we have to book a villa which is on 1 level and is disabled friendly. So it is highly likely we will never go on a holiday ever again. I have not been to a social event for 10 years. I couldn't attend any of my medical class reunions, partly because I couldn't leave Vivian on my own, and partly because my own personal body clock is adjusted to going to bed at 8 o'clock because of Vivian's care regime. I have been to some family funerals, but we have had to turn down every wedding invitation we've received in the last decade for obvious reasons. So I think you can see that this eminently preventable and avoidable stroke has had a devastating effect on both our lives. And in part 2, out very soon, I will be describing in great detail all the mistakes that were made by the NHS in the 2 years leading up to the stroke. See you soon. I would welcome your comments and feedback below this video, and I hope you do consider reading my book, which is available from Amazon, including a Kindle version. Bye for now.